Good afternoon. We'll go ahead and get started with the meeting. Welcome to the Health and Family Services meeting. This is our third meeting, and we have 4 important bills. We have some important guests with us today, so we're going to go ahead and get started. Secretary, if you could please take the roll.
Representative Bentley,
Yes, in the room.
Representative Bowling,
Here in the room.
Representative Bray,
Present in the room.
Representative Birch, Representative Dotson,
Present in the room.
thank you, Representative Elliott, Representative Fleming, Representative Frazier Gordon,
Present off campus.
Representative Marzian, Representative Gibbons Prunty,
Present in the room.
Representative Rayburn, Representative Raymond,
I'm here in my annex office.
thank you, Representative Riley,
Present in the room.
Representative Sharp,
Present in the room.
Representative Sheldon,
Present in the room.
Representative Tate, Representative Weber,
Present.
Representative Westrom, Representative Wilner,
Here in the room.
Chairwoman Mosier.
I'm here.
Wonderful.
Okay, we have a quorum established and are ready to do business. I'd like to take a moment just to thank our members, our friends from CAECO for being here today. We have Boone County Judge Executive Gary Moore here with us. He's the current president of NACO, immediate past president of the National Association of Counties. So welcome. And I don't know if Mayor Joe Meyer is in the room yet, but just wanted to say hello and welcome to everyone. Do we have any other any members who'd like to introduce any guests? Okay. All right. Well, we will go ahead and get started. The first piece of legislation on the agenda is Senate Bill 100. So, Senator Adams, if you would like to approach the table, and I don't know if you are joined by any guests. I know that we have 2 people online, and I'll go ahead and let you introduce yourself for the record, and please proceed.
Thank you, Madam Chair. My name is Julie Rocky Adams, and I represent Senate District 36. And I appreciate you taking the time to hear this bill because, as you know, there is an emergency clause on it, and the reason is because, I'll get into my statement, but the purpose of this bill, Senate Bill 100, is to establish an essential caregiver status for family members, guardians, friends, pastors, clergy, other individuals who would be allowed to visit residents of long-term care facilities, assisted living facilities, and mental health hospitals under certain safety protocols established by the Cabinet for Health and Family Services. So this legislation is modeled after the essential caregiver provision that was included in the 21 regular session House Bill 1. And then we also put it in the 21 special session Senate Bill 2. And so the essential caregiver provisions included in SB 2 are set to expire on January 31st, which is why I'm so grateful for you all including it.
We do have a committee sub.
Yes.
Thank you. And this will be the committee sub 2. All in favor of adopting the committee sub? Oh, okay. Hang on just a second. Do we have a question? Representative Marzian?
Thank you so much. Thank you for this bill. I've had a lot of calls about it or emails, but can you just give me a brief explanation of the committee sub because it was emailed to me at 10:22.
Yes, I'll be
And I was
happy to
driving.
go through it.
Thank you.
And I also want to say the reason for the sub is, we modeled it on what we had already passed, and we didn't think that there would be a lot of discussion, that it would be fine moving through. Well, after it moved through the Senate, we did have some people reach out and say, there's a few things that we would like you to tweak, one of which was the way that our Senate bill read is that it was only one person that was allowed to be able to visit. And sometimes, let's say me and my sisters, we would all like to go visit my mom or dad in the facility. So what the sub does to Representative Marzian's inquiry is if you go through, Section 3A is different than the Senate version. So Section 3A clarifies that at least one essential personal care visitor can visit the residence. This change addresses concerns that more than one caregiver could be prohibited from visiting a resident. This change is necessary to allow more than one caregiver to visit their loved ones. We believe that there is a safe way for siblings to be able to visit a parent together within a facility. Okay, and then the other change is 3F. And 3F clarifies that a facility can limit the visitation by an essential personal caregiver to the resident or residents that they are approved to visit. So rather than allowing a facility to limit visitation to one location within the facility, this change is necessary to address the needs of those who are immobile and they might have to meet in their room rather than in a designated spot within the facility. And then the other change is 3G, and that permits an assisted living, community, long-term care facility, or mental health hospital to limit the number of essential personal care visitors at any one time. So this change is in response to the feedback that we received from the Cabinet for Health and Family Services. So those are the big changes, but, as I said, it's, I'm sure we've all had stories from our constituents over the course of the pandemic where they say, I can't go visit my loved one. And so this will put in statute and codify their ability to visit their loved one in any of these facilities.
Okay, so just to be clear, I want to make sure that we have adopted the committee sub. We were kind of in process. So are there any further questions or any further discussion? Okay, so all in favor of adopting the committee sub 2, please say aye. Aye. Are there any opposed? Okay, thank you. Now, please proceed.
Okay, well, thank you.
Okay, thank you. We have a motion and a second on the bill. And I would just like to point out that there is one more small change that just aligned language in this bill with federal statute that removes the word compassionate from the name of the essential personal caregiver and just adopts the personal caregiver language. Yes, and so that's the other change that I wanted to just talk about, and this is permissive language, so this means that this is an option for facilities to adopt anytime, and the gist of this is that there will never be 0 visitors allowed.
Correct.
So that's the gist. We do have 2 guests online, and I would like to just give them each a couple of minutes, if you don't mind, since they've taken the time to be here, to just explain their thoughts about this provision. So first online we have Sherry Culp with who is the ombudsman with the Ombudsman's Office for Long-Term Care, and I probably got that wrong, but please introduce yourself for the record.
Thank you, Chairman. My name is Sherry Culp, and I am the State Long-Term Care Ombudsman in Kentucky. I became an ombudsman as a volunteer in 1996, and currently right now I'm the State Long-Term Care Ombudsman, which is housed as a nursing home ombudsman agency of the Bluegrass. During the pandemic, we saw some devastating effects of residents who were isolated and unable to gain access to visitors. Approximately 60% of residents don't have visitors. Of the 40% that do, there's a small percentage of them who have visitors that, come in. They're typically very close family members or friends, and they give care and they report. Some of them do that because of preferences, and providing direct care helps them have a strong connection with the residents. Others report doing it because if they didn't do it, it wouldn't get done, and they want to make sure that their loved ones bathe, their teeth are brushed, they're changed, things like that. While we advocate that long-term care facilities provide all the care and services that residents are entitled to, we hope that we never again see all visitors banned from visiting facilities in long-term care, residents in long-term care facilities, because we're concerned about an unnecessary decline. And we are so grateful for Senator Adams for recognizing these devastating effects of visitation bans. And these changes in the substitution I think most of them accommodate what my concerns were, the reason I asked to speak with you today. I just thank you so much for the substitutions. We know that residents need to be able to have these essential visitors at their bedside so that they have privacy and dignity when the caregiving tasks are being done. And, we know if there's anything that can be done to help clarify that these visitors could have access, day or night, because sometimes family members and friends who come in to provide care, they're doing care that's needed at different times of the day or night. But I just thank you so much for taking steps on this and allowing me to share with you today. Thank you.
Thank you so much for being here, and thank you for your comments and clarifying language. That was helpful. We also have Ms. Marla Carter online, I believe. Are you with us?
Yes.
I will.
Yes. Can you hear me?
Yes, I'd be delighted to give you a couple of minutes. Just please introduce
Great.
yourself for the record. Thank you.
Great. Thank you. Thank you so much for allowing me to speak today, Chairman Moser. My name is Marla Carter. I live in Owensboro, and my mother-in-law, Linda, resides in a nursing home just a few miles away from my home. My husband and I are her co-guardians. And the lockdowns and isolation have definitely had a very detrimental effect on Linda. In the summer and fall of 2020, we were doing weekly outdoor visits, 15 minutes, 6 feet apart, supervised. And these were very difficult for Linda because she did not understand why we couldn't come inside or why we couldn't hug her, no matter how many times we told her. And she really thought that we were abandoning her. Then in the fall of 2020, the COVID cases went up in our area, as in most places, and there were no more outside visits. So when we last saw her in November of 2020, she was talking, playing Jeopardy, painting craft projects. And then when we saw her in January 2021, just 2 months later, she was completely nonverbal, barely alert or aware of her surroundings. And yet when we would call to speak to the staff and inquire about her condition, they told us she was fine. She obviously was not. And I emailed each of you pictures of Linda so you could see the changes in her. Family members are direct care partners. No one knows our loved ones like we do. No one cares for our loved ones as much as we do. We provide their connection to their memories, to their sense of self and well-being. As another family member said to me, a blind person would not be denied her seeing eye dog, a hard of hearing person his hearing aid, an unstable person his cane, a non-ambulatory person his wheelchair. Family members are like a cognitive wheelchair for patients who have lost part of their mind. They're essential. For our loved ones who have failing cognitive ability, we are their compass. They know where they are in the world because of us. We need essential caregiver legislation because we are not just visitors. We are active care partners in the care of our loved ones. Nursing home caregivers are doing the best they can, but even before the pandemic, there was a chronic staffing problem in the industry. Family members and friends often operate as staff extenders. We brush teeth, comb hair, trim nails, look for missing glasses, hearing aids, TV remotes, and laundry items. We meet the social and spiritual needs of our loved ones in ways that an unfamiliar staff person cannot. We are not advocating for the doors to facilities to be wide open to anyone and everyone in an unsafe time. We recognize that there must be protections in place. Residents of long-term care already have the federally protected right to have visitors of their choice. So we just want to ensure that that right is protected for the residents who depend on their outside caregivers for so much of their support and care. I am so grateful to the legislature for addressing this issue. And it sounds like some of the concerns that I had with the bill have already been addressed. I'm anxious to read over those and to really protect the right of residents to their essential caregivers. We've learned that the bills must be quite specific. And so I have emailed each of you my concerns. And so for the sake of time, I'm not going to go into those because I've already seen them and seem to have addressed them. But thank you so much again for the opportunity to speak to you today.
Thank you so much for being here. Thank you so much for telling us the story of why this is so critical. I know that during the pandemic, we've all been touched. Our loved ones have been touched by this very much, and the isolation that our loved ones endured during the pandemic. We all wish that this had been in place prior to this. Certainly, this prepares us for any future events and just puts a really strong infrastructure in place, a plan in place, which allows facilities and families to have that really critical interaction with their loved one. We worked on this in House Bill 1 in 2021, and then again we extended it in the special session in House Bill 2. And I just wish that this had been in place when my dad was in his independent living community, and we were completely shut off from him in his last year of life. And I just think that, had we had access, maybe we would have gotten him, known that he needed the care that he needed a little sooner. So yesterday was a year since he passed. So this is very important to me. Thank you, Senator Adams. I appreciate this. Okay, so we have a motion and a second on the bill. Is there any further discussion, any questions? Okay, seeing none, Secretary, please take the roll. Thank you.
Representative Bentley?
Chair Lady, may I explain my vote?
Yes, sir.
I also, in my family, was affected by this. My cousin went in the hospital on Friday night. They told us we couldn't see him till the next day, and he died that night. So thank you for bringing this forward, and I vote yes.
Representative Bowling?
Yes.
Representative Bray?
Yes.
Representative Birch? Yes. Representative Dotson?
Yes.
Representative Elliott? Representative Fleming? Aye. Representative Frazier Gordon? Representative Marzian? Yes. Representative Gibbons Prunty?
Yes.
Representative Rayburn? Representative Raymond?
Yes.
Representative Riley?
I'd like to explain my vote.
Yes, sir.
I think we all know the devastation that this had on families and residents of assisted living and patients at nursing homes. I want to go at a little different angle real quick. When the pandemic hit, my wife was the executive director of an assisted living facility after a number of years being the director of nursing at a nursing home. But the emotional toll on her was devastating because she had to tell residents and their families all the time, you can't see each other. And so she would come home every day from work, and it was obvious the toll that it was taking on her. She told me all the time, she said, I feel like I'm a dictator because I got these people that I love and their families that I love, and I'm the one that's forced to not allow them to be with each other. And so for my wife, I vote yes.
Representative Sharp?
Aye.
Representative Sheldon?
Absolutely. Thank you, and yes.
Representative Tate?
Yes, thank you.
Representative Weber?
Yes.
Representative Westrom?
Thank you, Senator, for bringing this forward, and thank you, Marla, for giving us more information that really made this a better bill. I vote yes.
Representative Wilner?
Yes, and thank you.
Chairwoman Mosier?
Yes, ma'am.
Wonderful.
Okay, Senate Bill 100 passes with favorable expression as amended by Committee Sub 2, and we look forward to passing this on the House floor. Thank you so much. I appreciate it. Next on the agenda, we have House Bill 92, Representative Bentley, and I don't know if you have any guests with you. I know that Judge Moore, if you would like to join Representative Bentley at the table, I think that would be appropriate. And just everyone introduce yourselves for the record and please proceed. And we do have a committee sub that we need to adopt. We have a motion and a second to adopt the committee sub. All in favor, please say aye. Aye. Any opposed? All right. if you could please proceed in describing the committee sub. Thank you.
My name is Representative Bentley, District 98 of the Great Commonwealth State of Kentucky. To my left, this gentleman here, he works for the Attorney General. His name is Blake Christopher. He's Deputy General Counsel with the Office of the Attorney General. And this gentleman here, I'm going to let him introduce himself because everybody knows him already.
Thank you. I'm Gary Moore. I'm the Boone County.
Will you turn your microphone on, please?
Yes. I'm Gary Moore. I am the Judge Executive in Boone County and past president of Kentucky Association of Counties and past president of the National Association of Counties.
House Bill 92 was brought about really in 2021 when the General Assembly passed without a single nay vote what was known as HB 427. HB 427 created a plan for administering the settlement proceeds from the litigation against 4 manufacturers and distributors of opioids. House Bill 427 was signed into law and can be found in KRS 15.291 and 15.293. This House Bill 92 makes 3 changes to this KRS 15.293. The first change broadens the scope of settlements included in HB 427. Previously, only payments for the 4 major manufacturers and distributors of opioids were covered under House Bill 427. But there will be future settlements, many of which stem from the national opioid litigation in federal court in Ohio. We want to avoid having to create a new bill every time there is a new settlement. Consequently, this second change would apply House Bill 427's plan to any future settlements that arise from this national opioid litigation. Importantly, we've spoken to our local partners at KCO and KLC, and they're supportive of this change. The second change states that the plan created by House Bill 427 applies if the defendants declare bankruptcy. We want to be clear that any funds from a bankruptcy proceeding will be treated the same as those from a typical settlement. Third change. The third change was provided by and comes at the explicit request of the local government groups mentioned by House Bill 427. I believe representatives from these groups, KCO, KLC, League of Cities, and others are in the room today. And they have assured me that they agree to the language in this change. Under House Bill 427, 50% of settlement proceeds go to the State Opioid Abatement Fund and 50% go to the local governments. The local government share is to be distributed accordingly to an agreement reached by them. Local government leaders requested that 51% of the litigating local governments be required to approve of any agreement. This third and final change reflects that request. And I'm now happy to take your questions, or these other 2 gentlemen either would take questions.
Thank you, Representative Bentley. Do we have any questions? We have a motion and a second on the bill. Okay. Do we have any questions? Representative Elliott?
Thank you, Representative Bentley. I know this has been a very gigantic undertaking, working with all these groups. I do have a question about the distribution metrics, which is in Section 4 of the remaining 50% of the fund, which would go to the counties. How is that going to be distributed ultimately? That may be a technical question, but I'm interested in, is that by population or by?
Thank you for your question. I want to thank the AG's office and Dr. Bentley, Representative Bentley. There's no change in that part of the distribution in this particular committee sub. What was in the original bill is still the same. To answer your question more specifically, it's not population. It's based on number of pills distributed, it's number of overdoses. It's really to drill down to those impacted cities and counties, those communities, and get the funds where the impacts have happened. We felt like population wasn't a fair formula. And I'm the fourth largest county, so population would have benefited me.
Right.
But when we think about the Commonwealth and where these funds need to go, it's through those formulas. By the way, that's the same formula that sends the money to Kentucky from the national settlement. So the state distributions use the same formula that's in the bill you passed last year. That's not changing with this legislation.
And if I might follow up, Madam Chairman, I appreciate the answer. The list of local governments, urban county governments, and cities, has that been compiled? Is there an existing list at this moment that those funds would go to?
It'll actually go to all, whether a county filed or not, the way that the formula works. The breakdown, again, is through the formula that we discussed. What may be of question here is the 51%. So it'll take 51% of all the litigants to approve a settlement.
Sure.
And that's on the local side only. That does not impact the Commonwealth and its portion. We felt like if we didn't have at least a majority of the litigants agreeing to a settlement, either through a bankruptcy or a future case, that wouldn't be appropriate. But in the language, you'll see it does not change the formula for distributing funds. The 51% is just to enter into a new agreement.
Okay. Thank you, Madam Chairman.
Okay. Thank you, Representative Elliott, for that question. I think it's helpful to clarify those two very different parts of this bill. Do we have any other questions? Representative Marzion?
Thank you, Madam Chair. So now made me think of another question, Representative Elliott. So you said the money is just distributed. Is there an application process, or how does that work with the different county governments or cities or?
So, to clarify, there are two different sort of funds that will come as a result of House Bill 427 from last session. The first fund is the State Opioid Abatement Fund that the Commonwealth itself will run, and I would imagine that there would be some sort of process like you're discussing there for those funds to be distributed. The particular change that Mr. Moore was referring to refers only to the 50% of the funds that will go to counties and city governments. I will leave it to him to describe whether there will be any kind of application process or how those funds will be distributed. That's our local government partners are good partners, and I'll leave that for him to answer that question, but just wanted to clarify that point.
On the local government side, the 50% is through formula, so it will not be performance-based or applications like a grant would be. So it's strictly through formula, and it'll be distributed to each community through that formula. So,
and they won't have to have an application.
I believe that it will require a formal request from the local government, like an action of a fiscal court or a city council to request the funds. But I believe all they would have to do, my understanding, is that they would have to request their percentage, their formula dollars.
Thank you. Madam Chair, could I have one follow-up?
Yes, ma'am.
Thank you so much. So it's not population-based. It's based on the number of deaths in that county and the number of pills that have been prescribed? Is that correct?
That's the way it was done nationally, federally. For example, in eastern Kentucky, we have some counties may have 18 or 22 deaths, so they're weighted more in Appalachia, or whether it be McCracken County. So it is a fair distribution. And I think another point is all this trust money, the way we and I wrote this, is to be spent in Kentucky.
Good. And Madam Chair, can I have just one last question? I think this is a good bill. So thank you so much. Is there a criteria for the folks that apply for the money as how it's going to be used? You said you weren't looking at outcomes, but is it going to go to like a rehab center or needle exchange or what?
Thank you for your question, because that's a key component here. The permitted uses for these funds is the same for local governments as is for the state's 50%. And that was really at the request of the companies paying the settlement. They wanted to make sure, and we do too, that the funds go toward mitigating the damage that's been done. While roads are important and animal shelters are important, a county or a city couldn't receive these funds and use it for some use other than the permitted uses, and that's pretty tight.
Thank you so much.
Thank
Appreciate
you.
it.
Representative, I'll just add real quickly, a list of those uses can be found, I believe it's in Section 5 of House Bill 427, and it also leaves open the possibility for the Opioid Abatement Commission to basically determine any appropriate usage, even if it's not listed. But ultimately, that will be up to the commission itself, and how the commission distributes its share of the funds will be left up for the commission to decide. But I'm happy to point you into the direction of that list offline.
Thank you. Appreciate it.
And my point is the commission has not met yet. It'll be this year, later in the year, after some things have settled. I'm the only legislator on that committee, and every one of you out there in the whole assembly, come to me. This is a communication for the whole state of Kentucky, and we're concerned about our Commonwealth. So I have an open 2 ears, and I'll listen to you. Thank you.
Okay, thank you so much for that thorough discussion. I don't think I see any more questions or comments, so I will entertain a motion on the bill. Motion on the bill? We have a motion and a second. Secretary, please take the roll.
Representative Bentley?
Yes.
Representative Bowling?
Yes, I'd like to display my vote. I want to thank you all for your work on this. It's really important, especially giving the local governments the 51%, whether they want to settle or not. I think that was very important because, the state may decide that it's in their best interest to go ahead and settle. But, if our local governments, if they're not ready to settle, if they're not ready to do that at that time, they should have the right to continue their case to whatever level that might be. So I appreciate your all's work on this, and I fully support it. Thank you.
Representative Bray?
Yes.
Representative Birch? Representative Dotson?
Yes.
Representative Elliott? Representative Fleming? Representative Fraser Gordon? Representative Marzian? Representative Gibbons Prunty?
Yes.
Representative Rayburn? Representative Raymond?
Yes.
Representative Riley?
Yes.
Representative Sharp?
Yes.
Representative Sheldon?
Yes.
Representative Tate? Yes. Representative Weber?
Yes.
Representative Westrom? Representative Wilner?
Yes.
Chairwoman Mosier?
Yes.
Wonderful.
Okay. House Bill 92, as amended by Committee Sub 1, passes with favorable expression. Thank you very much for your work on this. This is a very good bill, a very good process, and a good thing for Kentucky. Thank you. Are you handing that to me? No. Okay. It's okay. All right, next we'll hear House Bill 240. Representative Bentley is at the table. I just want to say that we have just been handed a committee sub. Everyone just got this, and it is a small change, so I will allow it at the last minute, but we don't normally do this. Representative Bentley, if you have any guests, I don't know if you do. Okay. And if you could just introduce yourself again for the record, and welcome, please proceed.
I'll let you go ahead and introduce yourself.
Actually, after you introduce yourself, we'll go ahead and adopt the committee sub.
Good afternoon. I'm Jim Busser. I'm the Vice President for Policy and Government Relations for the Kentucky Hospital Association.
Okay, thank you.
And I'm Representative Bentley, District 98 of the great Commonwealth of the state of Kentucky.
All right, thank you very much. We do have a committee sub before us. Yes, we move adoption. We have a motion and a second. All in favor? Any opposed? Okay, thank you. Please proceed on the committee sub.
I'll let you.
On behalf of our hospitals, we very much appreciate the work that Dr. Bentley and the committee have done. In the last session, legislation was put in. There was an inadvertent error that would have kept our hospitals from being able to do remote pharmacy entries, and this bill will take care of that, and we really do appreciate that. On behalf of our patients, thank you very much.
This on House Bill 240, just that one sentence y'all see on your amended, and it just helps the hospitals because we had included them in it, and so this takes them out of it. It's simple as that. So.
Okay, thank you for that. And the committee sub, the only changed an and to an or, is my understanding.
Mm-hmm.
Can you just explain what that does here in this bill?
Let me find the one he gave me a minute ago. Here, this is it, right? Mm-hmm. Okay, in D there on the last page, you'll see that the pharmacies are not open to the public and do not dispense to walk-in patients in a retail setting or hospitals licensed under KRS 216B, and would have applied to them. And this way it eliminates them. Does that make sense? And a lot of people don't know that a pharmacy that does not dispense to walk-in patients is called a closed door pharmacy. And that's the reason they were included here. Because we were dealing with databases at the time of the crisis. And so we included them because they weren't dealing with the people. And then the hospitals were included, so now we're excluding them because they don't have any walk-in pharmacies. So, that makes sense?
All right. Thank you. Yeah. Representative Marzion first.
Thank you. Mm-hmm. I don't know if that clarification helped or not, but let me ask you this. So a hospital pharmacy dispenses medications to some of the patients that are discharged.
That's
so
correct.
Does that not count as walk-in, or that's in a different category? Just for clarification.
You can go ahead.
No, those are not considered walk-in. They are our hospital patients.
They're your patients, and you're filling the prescriptions for them to take home.
That's it.
And they couldn't come back for a refill at that hospital, or yes?
Outpatient.
It's for outpatients. Yes.
Yes, okay. That's called an outpatient pharmacy.
Representative Wilner.
I think I'm also just a little thrown off by the very late substitution here. So could you just give me an example, so I'm sure I understand this, of what is a pharmacy that's not open to the public, doesn't dispense to walk-in patients in a retail setting? So just an example or two of that type of pharmacy.
Those are called closed door. And probably Representative Sheldon can give you the most complete answer right here if you'd let him.
Yeah, you were next on my list to call on, so go right ahead.
Where the change was here is accidentally the word "and" was put in there because that would infer that both those, both the beginning and the end of that sentence would have had to apply, or certainly says something different. It says, if you're a hospital pharmacy, this bill does not, remote access to database does not apply. And if you're a closed door pharmacy, it doesn't apply. And you want an example of that, it'd be like mail order pharmacies that aren't open to, and that are, we have some companies in Louisville that employ 1,000 or better people that are closed door, that do some manufacturer rebate type work and dispense medications. And during the pandemic, what we found is we found some efficiencies and we found some things that worked very well. So that remote database was, we learned some things, so that's where this bill came from. As far as what we're doing today, unintendedly, we hospitals are using their big networks, right? Hospitals all over the world, and you have some hospitals that cover many states. They have to use some remote database type work, and especially our rural hospitals who can't afford to do some of this. So we didn't intend for them to be in here, and there's a long story why they are, but anyway, I'm glad they're taking them out, and this is what this is all about. Thank you.
Okay, thank you.
This also affects many Kentucky jobs, especially like in Senator Adams' district.
Okay, thank you. We have a motion and a second. Do we have any further discussion? Okay, seeing none. Secretary, please take the roll.
Representative Bentley?
Yes.
Representative Bowling?
Yes.
Representative Bray?
Yes.
Representative Birch? Representative Dotson?
Yes.
Representative Elliott? Representative Fleming? Representative Fraser Gordon? Representative Marzian? Representative Gibbons Prunty?
Yes.
Representative Rayburn? Representative Raymond?
Yes.
Representative Riley?
Yes.
Representative Sharp?
Yes.
Representative Sheldon?
Yes.
Representative Tate? Representative Weber?
Yes.
Representative Westrom? Representative Wilner?
Yes.
Chairwoman Mosier?
Yes, ma'am.
Wonderful.
Okay, House Bill 240, as amended by House Committee Sub 1, passes with favorable expression, and the same should pass on the House. Thank you. You're welcome. Thank you. Next, we have House Joint Resolution 5 and Representative Fleming. I don't know if you have any guests, but okay. Just introduce yourself for the record and please proceed.
Thank you, Madam Chair. I'm Ken Fleming. I represent District 48 in Jefferson County. What's before you is a very straightforward House Joint Resolution that really focuses on helping out the healthcare workforce. As we know, time in, time out, workforce is a big issue throughout the country, particularly in Kentucky. And this basically helps establish a recommendation to the various boards to make sure that they look at engaging in some type of interstate compact or ease or establish reciprocity procedures in order to bring in more folks into Kentucky to provide mental health services and so forth. And in there is a list of the boards. This bill, basically, or joint resolution, is a product of the severe mental health that we undertook last year, last year. This is 1 of 10, and so basically that's what it is in terms of just trying to help out with the workforce and making sure we have some type of reciprocity with other states, so we can provide better services and have more accessibility to folks with mental health.
We have a motion and a second on the bill. Do we have any questions? Okay. Secretary, please take the roll.
Representative Bentley? Representative Bowling? Representative Bray?
Yes.
Representative Birch? Representative Dotson?
Yes.
Representative Elliott? Representative Fleming?
Aye.
Representative Fraser Gordon? Representative Marzian? Representative Gibbons Prunty?
Yes.
Representative Rayburn? Representative Raymond?
Yes.
Representative Riley?
Yes.
Representative Sharp?
Yes.
Representative Sheldon?
Yes.
Representative Tate? Yes. Representative Weber?
Yes.
Representative Westrom? Representative Wilner?
Yes.
Chairwoman Mosier?
Yes. Okay, House Joint Resolution 5 passes with favorable expression. And I just want to thank you for bringing this, improving our access to care, and allowing all of these disciplines and healthcare workers will improve our healthcare worker shortage issues and allow folks to work across state lines and I applaud your efforts. Thank you very much.
Thank you, Madam
bringing
Chair.
this. Thank you. Okay. Seeing no further business, I'll entertain a motion to adjourn. We are adjourned. Thank you.